Hello, welcome to another scintillating installment of FAM 1266 Pharmacology 2. So this is a Camtasia presentation of the material that you need to know for week 10. This section is very short, but it is important information. During this lecture, we're going to look at drugs for the urinary system. Some of these drugs we've already done before. We've looked at in other systems, and they just play a role also in the urinary tract. You'll find them in several different sections of your textbook, pages 85, 146 to 147, and page 154. So if you remember from physiology, the urinary tract consists of two kidneys. Urine is produced inside of each kidney in little individual units called nephrons, which is made up of a clump of capillaries called the glomerulus and then the tubule. So the little nephrons are located in these structures, which are called the pyramids. They're busily producing urine. The urine then flows into the calyces and then down each ureter and then collects in the bladder. When the bladder is full, so about a cup and a half, the bladder stretches, and that sends a signal to the spinal cord and back to the bladder. The bladder contracts. The internal sphincter opens up and urine flows down into the urethra. And then at that point, we have voluntary control over the external sphincter, so we can decide if it's a good time to let the urine into the outside world or whether we'd be best to wait a little bit. So we can control this skeletal voluntary muscle, and that allows us to control the flow of urine. So when we're looking at drugs that treat disorders of the urinary tract, we're looking at diseases of the kidneys, the ureters, the bladder, and the urethra. We're not going to deal too much with kidney disorders, but we will talk about disorders of the rest of the urinary tract. The most common disorder is a urinary tract infection, and more common in women than men, and we discussed that in physiology. That's because of the shorter urethra. There also may be inflammation of the urinary tract. So inflammation of the bladder is called cystitis, C-Y-S-T-I-T-I-S. Inflammation of the urethra is called urethritis. One thing we talked about in physiology is incontinence, which is the inability to control this external sphincter, and that allows urine to leak out. There's not a lot of drugs that are useful in treating incontinence. However, especially urge incontinence, there are some options there, so we'll talk about that. Urinary retention, there are some drug options to treat urinary retention, which is when a person cannot fully empty their bladder, and so sometimes the bladder will fill up and then will overflow, and that can cause incontinence as well. It can cause the urine to leak. Finally, there are some drugs that actually act in the urinary system, specifically act in the kidney, but we've already talked about those. We use those to treat cardiovascular disorders, so we use them to treat high blood pressure, and also if there's excess fluid in the tissues, which we call edema, so we'll go over those briefly again. The most common urinary tract disorder is an infection. So that could be an infection, usually starts in the urethra, which is closest to the outside world, and then can spread up into the bladder, and then can spread up the ureters and finally into the kidney. Nearly all urinary tract infections are caused by bacteria, and it's usually E. coli bacteria. And I had this slide in physiology. So this is a urine sample that's been put underneath a microscope. And if you remember, urine is sterile, so there should not be any bacteria, but we can see E. coli bacteria in this urine sample. And we can also see white blood cells, which are there, of course, to get rid of the bacteria. So normally we wouldn't see white blood cells there either. We'll be testing urine in physiology with these test strips to test for things like the presence of bacteria or the presence of white blood cells to confirm whether or not there's a urinary tract infection. The first symptoms of urinary tract infections are painful urination, usually a burning sensation, frequent urination but not a lot of output, so feeling like you have to go very urgently all the time, but there's only a small bit of urine that's in the bladder. So urinary tract infections, if they're caused by bacteria, which they usually are treated with antibiotics, usually antibiotics that are effective against gram-negative bacteria like E. coli. So a standard course is a 3-day course of a drug that's called TMP-SMX, and it combines an antibiotic drug with a sulfa drug. So if you remember back to our anti-infective drugs, those were two different types of antibacterial drugs. So common brand names are Bactrim or Septra. Some other things you can do are also to increase the acidity of your urine, because it would be more hostile to bacteria, so to prevent them from multiplying. So things like increasing vitamin C in fruit juices. Cranberry juice temporarily increases the acidity of urine. It also suppresses the growth of bacteria because it contains a compound, because it's acidic, and it also contains a compound that seems to keep the bacteria from sticking to the wall of the urinary tract, so the wall of the bladder. And as a result, then when you drink lots of fluid, it flushes that bacteria out of the urinary tract. So it may help prevent urinary tract infections in some women, especially those that have recurrent infections. There was a 2012 study that looked at that. Drinking several glasses of cranberry juice a day appeared to offer more protection than taking the cranberry tablet, so drinking the actual juice itself. And then, of course, drinking lots of fluid as on top of that so that you can flush the urinary system. This is kind of a neat group of drugs. These are analgesic drugs for the urinary tract. So they don't get rid of infections, but they can treat pain that is caused by infections, or if somebody had surgery to the urinary tract, or different types of procedures, where they may insert a camera to look inside, a cystoscopy, so they can look inside the bladder. These drugs are given orally, but they actually have a local effect. So what happens is that the drug is actually excreted in urine. So you take it orally, it ends up in urine, and when it's in urine, that's when it provides a local anesthetic or pain relief on the lining of the urinary tract. Okay, so urinary incontinence, again, if you remember, is where a person does not have control over the pelvic floor muscles or the external sphincter, and as a result can't control the flow of urine. And as we discussed in physiology, there are several different types. There are 4 different types of urinary incontinence. Stress incontinence is where that when there's stress that's put on the bladder, urine leaks, and that's caused by weak pelvic floor muscles. So the most effective types of treatments for stress incontinence are things like Kegel exercises. And so, there's sort of a couple options, but they're not necessarily the most effective. Urge incontinence, however, that's when some person has a very sudden urgency and to void. So they may feel as though they don't have to urinate at all, and then suddenly there's an overwhelming urge. So there's this increased urgency and frequency that's due to involuntary or very severe bladder contractions. So there are a couple of drug options for that. Overflow incontinence is caused by an overfilling of the bladder, so essentially caused by urinary retention. And so there's a couple drug options for that. And the last is functional incontinence, which of course is not really appropriate to treat by drugs. So that's like a lack of mobility, or a lack of, or problems cognitively identifying those feelings of needing to void with actually making it to the bathroom, or simply can't make it. The only thing for stress incontinence is in postmenopausal women that estrogen, have low levels of estrogen. Vaginal estrogen may actually help strengthen or help with in combination with Kegel exercises, strengthening those pelvic floor muscles. Urge incontinence or overactive bladder, that can be treated with anticholinergic or antispasmodic drugs. So what these drugs do is they block the action of acetylcholine, which is the parasympathetic nervous system, and that decreases the contractions of the bladder wall. That allows more urine to accumulate in the bladder without the bladder having these really large contractions, and so then without causing the urge to urinate. So urinary retention is the inability to empty the bladder. It's usually caused by the bladder muscle not contracting enough to be able to expel the urine. And a very common cause of urinary retention is an enlarged prostate gland in men. So the prostate gland is involved in the reproductive system, but it's geographically it's located around the urethra. And so sometimes if it enlarges, then it pushes on the urethra, and then urine can't flow out of the bladder. The other thing could be a neurological disorder, so something, a problem with the nerves that run to and from the internal or the external sphincter. So some treatments for urinary retention that are non-drug would be catheterization. So either a person self-catheterizes intermittently, so inserts a catheter up the urethra into the bladder whenever they feel the urge to void, or an indwelling catheter that just remains there all the time. Surgery to decrease the size of the prostate gland may work. But there are some drugs, alpha blocker drugs, so they block alpha receptors. They will relax the smooth muscle in the sphincter in the urethra, and then that allows urine to flow more easily. You can treat the prostate enlargement, so for example, drugs that decrease the production of testosterone, which may be causing the prostate gland to grow larger. They used to treat urinary retention with a drug that mimics the parasympathetic nervous system so that it would stimulate the contraction of the bladder wall. That type of drug treatment is rarely used now, so it's usually the previous two that we just talked about. The last thing that we'll talk about is just a review, because we did talk about diuretic drugs when we were talking about cardiovascular drugs. So diuretic drugs are drugs that increase the volume of urine. So a good example that we know commonly are things like alcohol and caffeine. By increasing the volume of urine, the amount of water that's in the urine, we decrease the amount of water that's in the tissue. So we would decrease any fluid retention in the tissues or edema. By decreasing the fluid in the tissue, and we also decrease the fluid in the blood, and so that decreases our blood volume, which then decreases blood pressure. So a good example would be furosemide or Lasix. So these drugs would be used to treat things like high blood pressure, can be used to treat congestive heart failure, so the heart has an easier time pushing against a lower pressure. Something called nephrotic syndrome, N-E-P-H-R-O-T-I-C syndrome. So that's a kidney disorder that causes a lot of fluid to build up in the tissues. Cirrhosis of the liver also causes fluid to accumulate inside the abdominal cavity especially, and occasionally glaucoma and Meniere's disease. So those were some others that these drugs could be used to treat. So one thing we didn't talk about earlier is really specifically how diuretics work, and that's because you needed to have a little more information about how the kidney works. But do you remember that that when we're making urine, that sodium and potassium electrolytes are reabsorbed into the tubule, and if they're reabsorbed from the tubule into the blood. If we prevent them from being reabsorbed, then those electrolytes will stay inside the tubule, and then water will then follow and stay with them in order to dissolve them. So that's one way that these drugs work. is by preventing that reabsorption of sodium and potassium. So they hang out in the tubule here, and then water stays with them, and then more water ends up in urine. The other types of diuretics can work by just the drug itself ends up in the tubule and water stays in order to keep that drug dissolved. So either way, we end up with more water in the urine. These drugs, of course, are going to cause somebody to have to urinate more frequently. So especially at the start of the treatment, a person may feel like they have to go to the bathroom a lot more often. The drugs that work on sodium and potassium can have a side effect in causing chemical imbalances. So, for example, if we end up keeping a lot of potassium in the tubule, then we may lose potassium in the blood, and that may cause some side effects. The other thing is that it may some of these drugs may increase the amount of uric acid that's in the blood, or glucose that's in the blood. So increasing uric acid may cause something called gout, which is where we get uric acid crystals in joints, particularly the big toe joint of your foot. And certainly if it increases blood glucose, that can be more detrimental to somebody that has diabetes. So important to look at in terms of deciding which drug that you're going to use. Some drugs are what we call potassium sparing, so they don't affect potassium, so you won't get that chemical imbalance side effect. All right, that is all for urinary drugs. So next week we will continue on in class.